Toxoplasmosis is a parasitic disease caused by Toxoplasma gondii, a protozoan parasite that has the potential to infect cats and a variety of other warm-blooded animals, including humans. While it commonly remains asymptomatic in healthy felines, its implications can be significant for public health, particularly for pregnant women and individuals with compromised immune systems. In utero, transmission to infants can result in chorioretinitis and cognitive impairment. Although flu-like symptoms may manifest and lymphadenopathy can persist for months, the effects are comparatively minor in non-infants. Pregnant women, in general, may not exhibit any signs of infection. Immunocompromised individuals, such as AIDS patients, may experience the reactivation of previously contracted oocysts, leading to neurological complications like encephalitis, chorioretinitis, or occasionally pneumonia. Toxoplasma gondii serves as the causative agent, with the cat acting as the definitive host, enabling the completion of the organism's entire life cycle. Feline infection occurs in utero or while nursing as kittens or through the ingestion of cysts from intermediate hosts, typically rodents or birds, harboring bradyzoites in their tissues, or through the ingestion of oocysts excreted in the feces of other infected cats. Although a significant percentage of cats may test positive for Toxoplasma gondii antibodies, they may not necessarily be shedding oocysts. Oocyst shedding typically occurs in recently infected cats and is limited to 1 to 2 weeks, with most cats experiencing only one shedding episode in their lifetime. Oocysts only become infective after sporulation, a process taking over 24 hours. As a precaution, daily litter box maintenance is recommended, preferably by an individual who is not pregnant. In healthy cats, toxoplasmosis often goes unnoticed as the cats are asymptomatic, but it can manifest as mild respiratory or gastrointestinal symptoms. Immunocompromised cats, however, may experience more severe clinical signs, including fever, lethargy, anorexia, and respiratory distress. Kittens that contract toxoplasmosis in utero or while nursing may exhibit more severe symptoms, with ocular disease such as uveitis or death included. The go-to diagnostic method is serology to detect antibodies against Toxoplasmosis gondii. An IgM titer of 1 to 64 or greater suggests recent or active infection and that cat is at risk of shedding oocysts in their stools. Other diagnostic methods include PCR to detect the parasite's DNA in tissues or body fluids, and also tissue sample analysis for the presence of cysts or parasites. The list of differentials should include, for example, other gastrointestinal parasites, feline infectious peritonitis, and respiratory infections, as some of the symptoms may overlap. A combination of sulfadiazine and pyrimethamine is used in severe cases. Also, clindamycin is an antibiotic that's effective against Toxoplasma gondii and can be used to shorten the shedding. In healthy cats, the prognosis is generally favorable. However, severe cases can be fatal, especially in kittens and immunocompromised individuals. Prompt diagnosis and treatment are crucial for a positive outcome. Now, a few considerations to keep in mind. Pregnant women or immunocompromised individuals should avoid handling cat litter or use gloves and wash hands thoroughly afterwards. Also, feeding cats cooked meat can reduce the risk of infection, as raw meat can be a source of Toxoplasma gondii. And lastly, for owners with a long history of cat ownership, previous exposure and the development of an immune response are very likely. In such cases, testing for Toxoplasma antibody titers is advisable. A satisfactory antibody titer suggests immunity and safeguards the client from infection, particularly during the first trimester of pregnancy.